Welcome everybody to our webinar on the battle of the alpha hydroxy acids, lactic versus glycolic acid. It's going to be presented today by Bri. For those of you who were here last week, you'll know she's a licensed medical esthetician. She is a trainer for TheraDerm and has been in skincare as both a practitioner and a trainer for more than 10 years. So she has a lot of experience at teaching skin health as well as performing skin health. So then our other panelist, of course, is Dr. Beckman. He's the founder of TheraDerm, and he comes with us with, obviously, he's a board certified plastic and reconstructive surgeon. He's also a clinical associate professor for the School of Dermatology at UAMS, University of Arkansas Medical Sciences, which is really exciting. And he's also a biochemist. So he came up with these different products using that biochemistry degree. And last but not least, we have Darla. She's our general manager. Probably nice for some of you to be able to finally put a face with a name. She has a lot on her plate as she does have a wholesale territory. She also works with our estheticians, and then she also handles our across the pond accounts in the UK. So she has a lot going on. So, and I'm Christina. I do all the digital media, email, social, paid, all that good kind of stuff. That's me. So let's get on with it since we just have 30 minutes and jump right in. And Bri, I'll let you take over.
Perfect. Thank you, Christina. We're excited for the training today and to learn about the battle of the AHAs, or lactic and glycolic. So we'll get started with the webinar here. And as you all can see, let's start with the basics and what is a chemical peel. So regarding a chemical peel, this is going to be a type of exfoliation that helps to correct several skin concerns. It's going to use different types of chemical ingredients to exfoliate the skin. So it's going to stimulate the skin. Then the skin's going to repair itself by increased shedding of dead skin cells on the skin surface. And the results are going to be obtained from the superficial peeling agents within the ingredients, whether it's a lactic acid that we're going to be doing, which is going to be what we're going to be discussing as far as chemical ingredients today, versus the glycolic. And Dr. Beckman's going to speak to several of these slides as well. So again, what is a chemical peel? It's ingredients that use exfoliation to chemically exfoliate the skin. Let's talk about the benefits of chemical peels. The benefits of chemical peels are going to be associated with improving skin texture. You're also going to see an increase in the skin thickness from the new collagen formation. You're going to have enhanced skin barrier function. The chemical peel is also going to reveal a healthy, glowing skin complexion. It's going to remove sun damage, dark pigmentation. It's going to provide a brighter, more even skin tone. And it's also going to diminish things that we don't want on our skin, like fine lines, wrinkles, which is going to reveal a more radiant, youthful appearance. And then, of course, you're also going to get the benefits of reducing acne, acne scarring, as well as blemishes as well. And I love the, here you all can see the cute cartoon talking about the carrots. It looks, because it's like we want to get a chemical peel as clients and as providers because we want people to be able to see our skin healthy, smooth, and complement and look well rested. So the goals for chemical peels that we're going to see here on the screen as far as the slides go, regarding regulating and enhancing cell turnover. The chemical peels are also going to stimulate your skin cells, which provide a more youthful, smooth texture, which is going to result in new skin cells. It's going to stimulate the collagen elastin. And then as far as educating your clients on the chemical peels, we need to educate them on the process of the chemical peel. And we need to let them know that we can ensure them that this is going to be the beginning to skin success regarding healthy skin. And the next few slides here, let's dive into more of the scientific process of chemical peels and the agents as far as the layers of the skin and how the chemical peel is going to work within the skin. So if Dr. Beckman at this time could discuss in detail about the lactic acid and the chemical exfoliation process within the skin. Dr. B?
Good morning. Hello, everybody. The skin itself, as we all know, has different layers above the subdermal fatty tissue. And those layers are primarily the epidermis. Epi means outside or the outer layer. And then the dermal side is the next layer. There's a very loosely applied layer of basal cells at the bottom of the epidermis that connect to the dermis. And that's the level that separates when you have a blister from a sunburn or any other mechanism that causes blistering. So the epidermis is separate from the dermis. The epidermal cells are continually replacing themselves as the outer protective layer of skin. That turnover time from a basal cell dividing and bubbling up to the top at age 13 is about a 2-week period of time. As we get older in age, 50, 60 years old, that turnover time slows down significantly. So the coloration and surface characteristics are kind of like paint on a house that's been there 20 years. It gets a kind of a dullness and maybe some peeling, coarse roughness, and those sort of things. Where the dermis underneath is where collagen exists, and that collagen forms the thickness and the matrix of the skin itself. In other words, the strength and firmness to the skin. Elastic fibers or elastin also is down in the dermis, and we see various aspects of living tissue. There are blood vessels where the epidermis has no blood vessels. The dermis does have blood vessels, and this brings nutrients and brings oxygen to the skin. And what we want to do with peels is to both increase the health and normal youthful characteristics of the dermis as well as the epidermis. Then we have peels that are designed as superficial peels that work primarily on the epidermal elements, and that's what we're going to be talking about today. Those deeper peels, medium depth and deeper peels, work on the dermis itself, and we're really not going to get into those today. We will have those covered in a future Zoom, though.
So thank you, Dr. Beckman. So as you can see here in this on the slide, we have the surface outer layer of the skin, the epidermis, and then you can see the different layers of the epidermis, the stratum lucidum, the granulosum, the spinosum, and the basal layer. So we're going to speak to lactic acid, which is going to be staying within the epidermis layer of the skin today. So let's talk about how to enhance a chemical peel. So we have seen great results with dermaplaning and combining that with a lactic acid peel, because dermaplaning, it's going to be able to provide the mechanical exfoliation format to the skin, and so that's going to be able to remove the peach fuzz, which is also known as the vellus hair, and then of course dead skin cells. So what's going to happen is if you dermaplane before you do the chemical peel, it's going to provide deeper product penetration. It's going to be more even when you apply that lactic acid peel. And then of course it's going to promote smoother skin. It's going to help diminish the look of those fine lines. Dermaplaning is safe for all skin types, which is great. And then of course you're going to see instant results and no downtime, because we're combining mechanical exfoliation with that chemical exfoliation. And the chemical exfoliation that we're using, like Dr. Beckman just referenced, is staying within the epidermis. So you're not going to have any physical sheet peeling with a superficial chemical peel. So now let's dive into referencing and comparing glycolic versus lactic acid. This is going to be great information. And so we want to talk and reference comparing what the difference in these two AHAs are so that you understand it more effectively. So Dr. Beckman, talk to us about glycolic acid versus lactic acid so that we can understand the comparisons.
Well, there's a category of chemical acids. They're called alpha hydroxy acids, and that refers to the placement of a hydroxyl group, an OH group, on the second carbon atom. Lactic acid is a 3-carbon chain molecule. Glycolic acid is a 2-carbon chain. And as we know, smaller things react more rapidly than large things. It's easier to completely burn up a wood match in a few minutes than it is a backlog in your fireplace. And that has to do with the size and the oxidation and the chemical activity of that. Glycolic acid is not manufactured by the body. It's metabolized only as crystals that get excreted through the kidney. And there's some problems with that. I'll talk about it in just a minute. But because glycolic acid is only a 2-carbon molecule, it reacts much more quickly as a peeling agent. In other words, its chemical activity, if you put 70% glycolic acid on skin, within 15 minutes, or within 15 seconds, excuse me, you're going to probably need to be thinking about neutralizing that acid, because all of the alpha hydroxy acids need to be neutralized to stop their activity or effect. Now, lactic acid is an alpha hydroxy acid. It's an excellent peeling agent at both 50% or 70% concentrations. It's also the primary mediator of our body's immune system. So it has multiple functions in the body, and it exists in every cell in the body, not just skin. But it is the actual mediator when we get a burn, a chemical burn, or any other burn, or a splinter, or anything else in the skin. It reacts, the lactic acid in those cells turns the immune system on to do something to cause healing of that injury. So it's much more gentle on skin because it's already present in our skin, and our body's metabolism is focused on using lactic acid throughout the day. It's a great peel agent for sensitive or allergenic skin. Glycolic acid is a little bit harsh, and I prefer to not use glycolic acid, although there are companies that are based on using glycolic acid. The reason being that lactic acid couldn't be patented as a peel agent. So the next available alpha hydroxy acid was glycolic acid. And that's why we see it so prevalent out in the market.
Yes. So again, as he was referencing, glycolic acid, and lactic, they're both AHAs. Glycolic is derived from sugar cane, and it's only 2-carbon, correct, Dr. Beckman? So with it only being 2-carbon, it's a smaller molecule. So therefore, you're going to be more prone to easily burning the skin. And again, it's not metabolized by the body. It's excreted by the kidneys. Where lactic acid, it lives within our bodies. It's the main mediator of our immune system. It's present in every body and every cell in our body. And it's commercially derived from molasses. It's going to be 3-carbon. Therefore, it's a larger molecule. So it's going to be more gentle on the skin, and it's going to be safe for all skin types, even sensitive. So great information. So as far as what Theraderm and what we can offer regarding lactic acid peel solutions, we have 2 different options, and we have the lactic acid 50% and we have the lactic acid 70%. The pH levels of each are just going to vary just slightly. So 50 is going to be 1.8, where the pH of the 70 is going to be 1.4. And the benefits of lactic acid, so now that we know that it's an AHA, we understand where it's derived from, let's talk about the benefits of lactic acid. because Dr. Beckman referenced the fact that it's safe for all skin types, it's going to be great for sensitive skin. Therefore, the beauty of lactic acid, it's safe to use during pregnancy or while nursing. It's going to be non-irritating. It's minimal, if any, downtime, because you're not going to have that sheet peeling, because again, it's superficial, it's epidermal. You're going to have little post-pill redness, if any at all. It also is going to be able to help with absorption of other ingredients into our product. So it's going to increase the efficacy of your facial treatment if you follow with a mask or possibly LED, or like we learned before, you can do dermaplaning before to enhance the lactic acid peel. So let's dive into lactic acid in regards to learning about where it originated from, the reaction time, and other things that we're going to learn about lactic acid. So Dr. Beckman, talk about the origination of lactic acid versus glycolic acid.
Well, of course, the origin in our cells is natural biologically, but when we're talking about peels or topical products of lactic acids, the vegetable kingdom uses the same enzyme systems as the mammalian systems. They just work in reverse. Sunlight goes into a green plant, and photosynthesis causes the formation of glucose and creation of oxygen. When we eat a carbohydrate, we produce carbon dioxide and energy for our own use. And that carbon dioxide then goes back and gets recycled through plants. Glycolic acid is synthetic, and it's usually produced from formaldehyde. They say that it might come from corn or other places, but from a technical standpoint, it's a hydroxy acetic acid, and formaldehyde is cheaper to use than an agricultural product that has to be several processes before you get to a product. So lactic acid has absolutely zero toxicity.
Even, they didn't neutralize it, and over the next 5 days, just a daily phone call and post-care, they were okay, which leads us to our next slide talking about reaction time. 70% lactic versus glycolic 70%. I can't imagine what would happen to the skin. Well, I mean, we know what would happen to the skin if we didn't neutralize glycolic acid 70%. It would not be the same outcome for sure.
Well, that's true. And with glycolic acid, the reaction time is so quick that as soon as you're putting it on, you need to be thinking about neutralizing it. So you need to have all your neutralization products handy and be able to neutralize at the earliest sign of redness. And if you're not thinking about it and you slap it on, and the nurse or doctor or a visitor comes to the door to ask a question, you may be past that 15 seconds needed to prevent an unfavorable result. So pay attention time-wise with glycolic acid. Lactic, you have 2 to 3 minutes usually to neutralize.
Right. So with the reaction time, let's talk about controllability of it. So lactic acid is easy and it's excellent to control. You're going to have more predictable peel results with it, where glycolic, it can be difficult to control the peel. And what is contributed to that, Dr. Beckman? Is that going to be the amount of carbon? Is it where it's derived from? Is it a variable of different factors of why we can't control glycolic acid?
Well, it's more related to unpredictable. In other words, with lactic acid, we can predict how every skin type that we see is going to be affected or react to a 70% or 50% lactic peel. Different skin types react at different speeds to glycolic acid. So you're not as sure about the settings, whether to cook your egg at 1 minute or 3 minutes. It's just more easy to predict based on a person's skin type and what their skin conditions are that you're treating using lactic acid. I just find it's much easier to be universally predictable.
Be safe for our patients. So let's talk about the humectant ability of lactic versus glycolic.
Well, lactic acid is a natural humectant. As a matter of fact, if you were to take all the products in a beauty counter array of products, many of those will have 1% lactic acid as an ingredient in those products, primarily to allow a better penetration of that product on skin. And those are not medical peel products, those are cosmetic products. So the humectant ability, and humectant just means the ability to attract water or to absorb into the skin and pull water with it. And so lactic acid has been proven as an exceptional humectant for years and years and years. I'm not aware of any glycolic acid studies that have shown a humectant effect.
Which is so important because we don't want to have transepidermal water loss in the skin, because then that's going to cause unhealthy skin, it's going to cause skin disease. So we want to make sure that we're always hydrating the skin, because when the skin's hydrated, it can communicate more effectively to produce an anti-aging result, a better result. Hyperpigmentation, so which is always a concern for all clients because of sun damage. Hyperpigmentation is known as dark spots on the skin. And then of course we all have a concern of post-procedure or post-inflammatory hyperpigmentation as a concern of when we do chemical exfoliation to the skin. So let's talk about how lactic acid versus glycolic affects those concerns, specifically hyperpigmentation.
Well, I think the key word was the post-inflammatory hyperpigmentation you described, and that's a known entity. You can get that with lactic acid, but you almost have to have it on your mind to purposefully do that. And when I say that, there are some patient types like or conditions of vitiligo where you do want to get some more pigment going in a skin surface that's devoid of melanin pigment. That's totally different than what we're talking about here. But because the glycolic acid reacts so quickly, you can actually burn skin. So you get that post-traumatic or post-inflammatory pigment formation as a result to healing burn. So it's not it's the size of the molecule and a chemical burn that would cause that post-inflammatory hyperpigment problem. In lactic acid, we just don't see that.
Right, because of the size of the molecule and because he keep referencing burn, where lactic is going to be that controlled chemical exfoliation, where glycolic, it's going to be fast and rapid because it's small. So then it can lead to that possible burn. And when you create that possible burn, your skin thinks that that is harm, which it is. So then it goes into overdrive to protect it, producing excessive melanocyte activity to then in return create post-inflammatory hyperpigmentation. So we don't have to worry about that with lactic acid, which is great. So as far as irritation, lactic acid versus glycolic, the general effect of lactic acid compared to glycolic. So talk about irritation as far as why is it less irritating?
Well, there's essentially no irritation factor with lactic acid. As a matter of fact, we have a patent pending on a formulation using 10% lactic acid, as we've seen in our fruit acid product, which is 10% to put on topically and leave it. if a person has an acute red lobster sunburn and puts 10% lactic acid on it in our formulation.
So as far as absorption of lactic acid versus glycolic acid, does glycolic acid, is it easily absorbed into the skin, or do we have complications with that? Talk about that.
Well, both lactic acid and glycolic acid are absorbed by the skin. What happens with the 70%, it is easily absorbed into the epidermal stratum corneum cells to get to the layer that we'd want to get to. In the lower concentration, it actually enhances the absorption of all the other ingredients. And if you think about it, if you take a peel agent like lactic acid 70% and put it on skin and you then rinse that off with water, you basically have lowered the concentration. There's still some trace molecules of lactic acid, and it gets back into the enhancement qualities, as I mentioned with other cosmetics. They put lactic acid in to improve or enhance the absorption of other ingredients. So yeah, it's going to increase the absorption of any of the skin oils. I prefer lanolin because it's a natural animal-based skin oil. But vitamin C, xylocaine, which is a local anesthetic, any of those things are going to be absorbed better if there's a lactic acid with that. There again, glycolic acid, I've not read anything that would make me think from a scientific standpoint or studies that it enhances the absorption. We do know that glycolic itself is absorbed because of that transplant kidney that got knocked out from 170% glycolic peel.
Right, but we're not getting any enhancement. The process here, lactic acid, as we have learned, is controlled, and you're going to have predictable results, which is so important, versus glycolic, we're going to have less predictable results. And why is that? Remind us again.
Well, it has to do with the fact that different skins or different skin types have different characteristics. Different ages have different thicknesses of their stratum corneum. Different skin conditions. Acne is an example. The different amount of oil content within the cells and the secretion of skin oils, all those things are variables that are very easily predicted with lactic acid, and they're a little bit difficult to predict with glycolic acid. For instance, a person that has, let's say, a blonde-headed, light-skinned, blue-eyed person with sensitive skin, it's going to be very difficult to control a glycolic acid peel on that skin type, especially if they have sensitivities or allergenic components. So that all goes into why I prefer lactic.
And then referencing the immune system, again, lactic acid enhances the immune system, where glycolic acid, as far as we know, there's no known effect on the immune system. And regarding safety of the lactic acid and the glycolic peels, the lactic acid, as we have learned, it's easier and safer to use, even high concentrations. There's zero toxicity because it does live in every cell in our body. It's the main mediator of our immune system. Glycolic acid, it's difficult to use safely at high concentrations. And we know that there is toxicity that exists for some people because of the absorption of glycolic acid. So let's talk about peel protocol and as far as product application real quick. So if we are going to be doing a lactic acid peel, the first step that we're going to do is we're going to apply the new peel, the enzyme peel gel. We're going to leave that on for 1 to 2 minutes. We're going to massage it in. Then, of course, cleanse the skin. Then we're going to apply the fruit acid exfoliant. And then we would apply the actual lactic acid peel, whether it's the 50% or the 70%. We're going to leave it on for 3 to 5 minutes, and then we're going to neutralize with the sodium bicarb, cold compress, the Eternox peptide, OPC, and SPF, the platinum protection. So super easy peel protocol to follow. So let's look at some different patients that Dr. Beckman has here for us. So talk about patient number 1, 69-year-old, main concerns, pigment, fine lines, and texture.
Well, we know that just from age, 69 years is going to be different than 29 years. So we know that there's going to be a slowed cell turnover in skin, and that there's going to be evidence of sun damage, irregular pigment, things of that sort. Definitely that patient would need to have some pre-peel conditioning of skin, a good healthy skin to start with, even though her age is going to provide some not complications, but some difficulties in dealing with. This lady, I'm thinking really doesn't have any allergies, but our concerns would be that to get a deep enough peel to eradicate her or to normalize her pigment, excuse me, she's going to have a series of peels rather than one big hammer to get rid of all those things at one time. And so we want the skin as healthy as it can be to start with, and we want to use a peel that both increases the exfoliation of the external layers and evens out the melanocyte production of melanin. And that patient may well even be a candidate for a medium depth peel. I probably would consider a medium depth peel agent rather than glycolic or lactic, either one, just because they're superficial peeling agent, and she has some conditions apparent in her skin from the deepness of the wrinkles and the amount of pigment. She's probably going to need a little deeper peel than either of those two superficials, but she'll get an improvement from a superficial peeling agent in repeated series of peels.
Yes. So patient number 2, and so this is going to be 32-year-old. Options for peels is going to be, or excuse me, her main concern is going to be scarring, texture, dullness, as we can see. She's not on any skin regimen. She uses Dove facial soap to wash and shower. So as far as the way we would handle this patient, we would get her on a TheraDerm skincare system. We would prepare her skin with a prepare kit, and then of course options would be lactic 50% or 70%, Desna or even TCA 10% under a medical director supervision. Patient number 3, this is going to be a 16-year-old. Her main concerns, as we can see, is going to be acne, texture, uneven skin tone. Patient is on a skincare regimen from her dermatologist, which consists of a topical acne agent and salicylic acne wash. So then we look at her and we analyze as far as do a skin analysis of what peel type. Options would be lactic acid 50, 70%, Jasna or TCA 10% under a medical director's supervision. And then of course, other patient treatments along the way, we could add in some different lasers that would kill that P. acnes bacteria that's present on her skin. And as Dr. Beckman was referring to earlier on the other patient, I believe, and Dr. Beckman, you can agree or disagree with all 4 of these patients that we have up here, or excuse me, 5, they would need a series of chemical peels. For sure.
I think you're absolutely right there. If we went back to, I think it was patient number 2 that had those, I call them moon crater scars from her acne.
Yes.
This is a patient where we also should consider not only peels, which do an even painting, if you will, of the surface, but maybe some microdermabrasion or some microneedling to the acne scars. In other words, combining more than just a peel for that patient.
Absolutely.
With depth problem, scars. Anyway, didn't mean to interrupt.
No, that's great. So we have concluded our webinar regarding the battle of the AHAs, glycolic versus lactic acid. We hope you guys have learned a lot. So now at this time, we will let Darla and Christina refer to any questions that you guys might have.
Okay, Lori was asking about, is the advanced chemical peel class for medical professionals only, Bri?
No, it's for students and medical professionals. So for that approval, we have to see your license. If you're a licensed professional or if you're in school, we have to receive a email or letter via your instructor.
Okay, I think that's all the questions I'm seeing.
Yep.
So I think we're done. If you guys do have any other questions, feel free to email me and we will get those answered by Bri or Dr. Beckman. And we will see you next week on Wednesday, and it'll be about the Jesner's chemical peels.
Yes.
Sounds great.
Yep.
All right, see you guys next week.
See you. Goodbye.
Bye.
Bye.
Thank you.